it's very exciting to be able to share the new tool with you. I'll show you now the version, which is live now. So to give you an idea also on what it looks like and what the user flow is like using the tool. The first thing you might notice, if any of you were familiar with the previous version of the tool, is that visually it is now quite different. And this was also one of the main objectives, trying to improve the tool to make it more usable, so to improve the user experience, and also to just overall provide a lot more guidance and make the process kind of as straightforward as possible. So here in the first page, you can see all the different plans which you could have created within the tool, which is also something new. So now you can actually have multiple plans at once and evaluate them simultaneously. And you also have an example plan. So this again was feedback that we've received quite often. It would be very nice to see how the tool works on an existing kind of example plan, also to offer more guidance for you. So what I'll share with you now is the assessment we did with Bradford, so focusing on their plan, which was seeking to transform the city centre in two ways, so introducing a lot more green infrastructure, but also focusing on promoting active travel. So here in the summary page, what you see, the first page that you'll access provides some overview of the three stages, the three main stages that are part of the process. So starting with the setup, where you can see the contextual information relating to your plan, the priorities you've selected, and the baseline status. Then down below, you have the actions, so the different actions that make up your plan. And here on the side, you already see kind of three headline results of what your plan has achieved. So to walk you through the process, we'll begin with the setup. Here, basically what we ask is that you input very basic information about your plan name, a description, select the plan type. And after this, we move on to the context. So here we ask you to input the affected population. So how many people will be affected by this plan, which could either be the residents in the area, but can also include regular visitors, as was the case in Bradford. And it's the city centre, so a lot of people that would actually be benefiting from the plan aren't necessarily inhabitants, but use this area. Another two factors that we ask you to define to be able to understand your context better is the socioeconomic status of the area, as well as levels of physical activity. And then finally, the total plan cost, which we will take into account when we provide the results of how much your plan could be saving. Then what we have are the health settings. So basically the values that we use in the calculation, these are a result from the research that was done by the University of Lisbon, and they refer to European cost averages for these different health indicators. What we've done is that we've already pre-fed these into the tool so that they're available for everyone to use and provide kind of rough estimates. But we've also included the option for you to be able to edit these values directly. So if you have data that is more specific to your area, to your country, you can modify this, and then the results that the tool provides will be much more detailed and suited to your context. Another thing to mention, and also an improvement that we consider quite substantial from the previous version of the tool, is that we've included a great more deal of explanations. So basically for every step or for every concept that we introduce in the tool, you will find an information box with more information about what this means, but also links to, for example, here, the research report, so that you can also go and have a much more better understanding of where all these numbers come from and how they're factored into the final calculations. After this, the next step would be to define your priorities. So as Martha said at the very beginning, when we try and use urban planning as a way to improve the health of the population, the area that we're working in, it's very important that we start considering health from the very beginning. So what we mean by this is that we should define what health priorities you want to have an impact on, or what you want to improve in terms of health. So basically here we have the list of these 30 health indicators that are included in our method and in the tool, that cover environmental health, lifestyle factors, physical health, and mental health. One question that you might have is how do we know which priorities we want to focus on? And this could come from data that you have for your city or for your neighborhood. You may have data about these different health indicators that allows you to see which one is in need of more improvement. It could also depend on the population of the area. As Amber was saying, it's not the same having a wealthier area or an area with a lot of families and young children, or an area with more elderly populations. But these could also be priorities. So if to align this also with the health strategy that you might have in your cities. These will often determine a few priority issues that we want to focus on. So these could also be the health indicators that you select here to address. So I'll just show you here if as we select or deselect certain health indicators, you can see the results here in the diagram on the right will change. What this graph is telling us is basically out of the 20 urban determinants that we take into account in the tool, so these aspects linking to urban planning to the urban environment that have an impact on health, which ones are linked to a highest number of our health indicators, so of our priority health issues. In this case, for example, it's very clear that improving green coverage and increasing the green coverage in this area will really help us tackle almost all the health priorities that we've selected. The next and final stage of the setup first part of the process is to assess your baseline. So again, this is an improvement from the previous tool, and this really helps us also to tailor the results to take into account your context. So we know that, of course, every context is different. So what we ask here is that based on the area that you're working in, where you're implementing this plan, you tell us or you rate the state of each one of these 20 urban determinants in this area. For example, how would you rate the population density in this area? You can choose, well, go from very negative to very positive. And although this is defined by the user, so we don't actually require the user to input any specific data to be able to establish this rating. What we do provide are a series of questions and kind of guiding prompts to help you assess and define whether you consider that your area is in a very negative or in a very positive state. These questions provide some specific values. So for example, here in population density, based also on the literature, we know that between 50 and 150 dwellings per hectare is the recommended optimal range of density. But as we know that every context is very different, we provide these questions, but in the end, we leave it up to you who have the knowledge, the technical knowledge of your area to define exactly where you believe this impact lies. And other questions don't include specific metrics, but they're more open answer questions to guide your assessment process. Once you fill in all these ratings for each one of the urban determinants, you'll be able to see the baseline profile. So basically, how your profile, how the status is kind of contemplating the whole set of the 20 urban determinants, and then this also helps you to identify where the strengths and weaknesses lie. And then we have the needs diagram, which basically combines the urban priorities that we identified in the previous step with your baseline. So this allows us to factor in also the strengths and weaknesses that exist already in your area to better define the needs that you should be addressing in your plan. So basically, if you had an urban determinant that was very negative in the baseline, this will increase the need to improve this specific urban determinant. And again, you can see here info boxes which provide a lot more detail on exactly what these graphs are showing and how we calculate the different parts. So the second stage of the assessment process is to review your plan. So the first part within this is to define actions. So actions are, well, the specific actions that make up your plan. How do we define these? This depends on the scope of your plan and also how detailed you want your assessment to be. Here we also, I think it's important to say, and I think there was already some question about this in the chat, that we really tried to make this tool as flexible and adaptable as possible. So it works at a range of different scales and kind of geographic areas. So for example, if you were working on a citywide strategy, one option would be to define specific actions based on these lines of strategic lines of priority within this document or this master plan. For example, one focusing on introducing green infrastructure, one focusing on active mobility, which is the case, for example, here in Bradford. But another option, if you're conducting this at a neighborhood scale or even below this scale, you could get a lot more concrete with your actions. So for example, as Amber shared before from Cascais, one action could be removing a car park and replacing this with a different type of use, creating a new park, or improving the links between different commercial areas, for example. I'll walk you through one of the actions that we had for Bradford, which focuses on greening and introducing green infrastructure into the city centre. So what we ask you here is very similar in structure to the baseline. So you have to establish the impact that your action will have on each one of these urban determinants of health. The difference from the baseline is that we're now no longer assessing your existing area. we're assessing the impact that your plan will have on improving these different aspects. So for example, just to show you about variety or increasing the proximity to public spaces, the impact that this specific action will have on this is very positive due to this being a kind of core part of the action to try and reshape the city centre landscape to make it a lot more, to have a lot more public space readily accessible. Again, here what we provide are a variety of different prompts and guiding questions to help you establish the level of this impact. And here on the right, we can already see also the results for the specific action in terms of the health outcomes. So how this action is performing in relation to all these 30 health indicators. In this case, for example, if we go to mental health, we'll see that this action is actually doing everything that's in our hands as urban planners to improve the levels of stress in this area. And then again, we show the action profile. So basically the visualization of how this impact is distributed around the 20 urban determinants, and then how this action is also helping you to meet your needs in terms of each specific determinant. So again, just as an example, we saw that increasing green coverage was a very big need for this specific context, and we can see that this action is helping us, is actually reaching this need, not 100%. Then we have the action impact diagram, which is easy or useful to compare the impact that different actions will have. And then just finally at the top of the page, you can already start to see some of the results at plan level. So the idea is that also as you fill in the actions, as you add different actions to make up your plan, you can start to see how building up different actions also contributes to increasing the score, the overall healthy cities score of your plan, and increase the economic savings that are estimated to be achieved through your plan. I'll go now straight to the results page, which is the final stage of this assessment, and really it's where you can visualize results in three different sections. So to begin with, again, we provide the kind of three headline results. So one relating to improvements of the urban environment. So this is the Healthy Cities score that measures both the impact and the scope of how you're contributing to improve the urban environment. Then we have estimated savings, so how much your plan could be saving per year, and the months gained in terms of life expectancy that you could also expect due to improvements. Then the next section on results looks at the improvements relating to the urban environment. So based also comparing with your baseline, how the impact of all of your actions combined, so the total plan overlays with the baseline. So you can see also if what before were weaknesses are something that now the plan will have a very big impact on. We can see how your needs have been met. So this is also useful to identify if there are certain needs that haven't been met, what can we do to try and improve this? And then again, the actions impact, where you can easily visualize and compare the impact that all the different actions of your plan are having. The next section focuses on health outcomes. So here, again, we have three key figures, which are, again, the months gained in terms of life expectancy, the deaths avoided, and the disability-adjusted life years that could be avoided. Then we have a detailed view of, again, these 30 health indicators that we include in our assessment. So of environment, lifestyle, physical health, and mental health issues, and how your overall plan is achieving a kind of absolute impact on each one of these indicators, but also the performance. So basically in relative terms, out of everything that we can do through urban planning, how much we are actually achieving with this plan for each specific health indicator. Then afterwards, we can see the action side by side. So again, a very useful tool and diagram to be able to compare the impact that is due from each different action, and see also in terms of specific health outcomes, how one compares to another. And then lastly, what we have are the economic impact results. So again, the three key figures, which in this case are the total savings per year due to your health improvements due to urban changes or changes in the urban environment. Savings per person per year. So again, taking into account also your population, or the affected population by this plan, how much you could expect to save per person. And a time frame of when you could expect this return on investment based also on the total cost of your plan. Then again, we have a more detailed view into the specific health indicators. And here we included kind of all the different factors that are taken into account in the calculation. So you can easily understand where this comes from, and then also understand which one of these health indicators is achieving or has more potential for saving in terms of the economic saving. One last thing I would just like to mention quickly is this comment section, which is a feature we thought would be very interesting to try to promote collaborative working. So this assessment process is really something that we suggest is done as a team, so that you work together, engaging with people from different departments. And this comment section just basically allows you to kind of track and coordinate on who should be completing which part of the assessment, who should be focusing on what action. And it also allows you to kind of add any notes or comments that you think you need to clarify your assessment process or just to refer to in the future. One last thing I would like to mention quickly is that we also have some downloadable PDFs, such as this one, where you can find a lot more information on specifically the health outcomes, the health indicators that we include, and the urban determinants that are included in the tool. And finally, we have seen here the results section, but another feature that is not currently available yet on the tool, but will be shortly, is the comparison, the option to compare. So maybe you have a plan and you have two different options for this plan that consider different aspects. So maybe one action changes slightly and you want to be able to easily compare to see which one of these options provides a higher economic savings or a better health impact. So this will be a feature that will be available soon and will allow this precisely to be able to compare different alternatives that you have for a same plan.